Our next presenter is Sandy Birnbaum. That's the Philadelphia explanation or pronunciation of that name. Sandy is a licensed clinical social worker with a psychotherapy and family therapy practice in Connecticut and New York. She has 19 years of professional experience working with Lyme disease patients and their families. The title of her presentation tonight is Beyond the Medical, the Challenge of Living with Lyme Disease. She's already here behind me, but please welcome her.
Thank you. And thank you to Time for Lyme. When you enter the world of Lyme disease, you truly enter a bizarre alternate universe. A simple tick bite leads to symptoms that affect your body and brain to an extent that is hard to believe. You search for months or years to find a doctor who can tell you what is wrong, find treatments that work. But for many chronic Lyme patients, the progress towards wellness is slow. Along the road, many of you may learn that you need to see a psychiatrist, not because you're mentally ill, but because you need adjunctive treatment for problems with sleep, alertness, cognitive and executive functioning, headaches, abdominal or other pain. You may need a neuropsychological evaluation to gain a better understanding of the impact the disease has had on your ability to think, to learn, to function in an academic or a work setting. Your private world of doctor's appointments, medications, and blood tests is like no other. Outsiders often have a hard time understanding why you are so ill and need so many interventions. When you don't have cancer, you haven't had a heart attack, you were just bitten by a tick. It can't be that bad. Living with Lyme disease can be a very isolating experience. The great majority of Lyme patients, kids and adults alike, do not look sick. It is hard for people around them to understand and appreciate how ill the patient truly is when the symptoms don't show. How does a 35-year-old woman who was physically fit prior to encountering Lyme disease explain to people that she can't even walk to the mailbox because she gets so dizzy and disoriented? How can a college graduate explain that he can't read because he can't track words on the page? How does a teenager describe his experience with conversation in the room when he can only process parts of the conversation and tries to fill the gaps in his head? A mother brought her 12-year-old daughter to me from out of state a couple of years ago. The child was quite debilitated from Lyme disease, having seen many doctors who failed to diagnose her until she found one who made an accurate diagnosis and began treatment. This mother told me that before she found the Lyme literate doctor, her daughter's medical decline was so severe, she had every reason to believe that her daughter was going to die. This beautiful young girl was in a wheelchair, fully engaged with me and with her mother during our session, and aside from the wheelchair, appeared quite healthy and bright. Besides her physical symptoms, however, she had completely lost the ability to read. Tick-borne disease had taken that away from her. She had recently been in a medical rehab facility for a lengthy period of time, and her best friend there was a boy her age who suffered from traumatic brain injury from a car accident. He had told her that she was just like him, had similar problems. In the course of the session, I said to her, you know, for many people, Lyme disease is a brain infection. Her reaction was pure joy. She kept repeating to her mother, that makes sense. Why didn't anyone ever tell me that? My friend was right. It's not me. It's my brain that isn't working. She no longer saw her brain problems as an indication of who she was, but had a new and accurate perspective on it, understanding that it was, in fact, her illness. I then reinforced what her doctor had told her. Lyme disease is treatable. I had seen others get well. She was intensely relieved and happy when she left my office, despite the wheelchair and despite the severe limitations on her life that Lyme disease had caused. When I see Lyme patients, I work with them on viewing Lyme disease as an illness that they are dealing with, rather than what defines who they are, their personality, their character. This is an important distinction to keep in mind. Some patients, particularly children, see their psychiatric and cognitive symptoms as just an innate part of their being. If they break a leg or they get the flu or an ear infection, they don't see that as defining who they are. But for many patients, the controversy surrounding Lyme disease, the misleading diagnoses and treatment recommendations that Lyme patients are given prior to receiving the Lyme diagnosis, the way they're treated by family and friends, impacts the way they see themselves. There's an increasing propensity, driven by the IDSA's recent statements and published articles, to give mental illness diagnoses to Lyme patients whose symptoms don't resolve after a few weeks of treatment. That not only impacts important concrete issues like insurance reimbursements, claims for disability, and education plans for Lyme patients, it also escalates the confusion many of the patients and their family members have over what Lyme disease really is. It exacerbates the sense of isolation the patients experience when their illness is not only denied, but they are now told they have a mental illness, not only if they have mood or cognitive problems, but even if they're in physical pain. The pain is defined as psychogenic, and the remedy is psychiatric medication and psychotherapy modalities that cannot possibly be effective, since the cause of the patient's pain is not addressed. It's medical, not psychogenic. And most important, the medical treatment they need is being denied. Another factor that affects the self-view of the patient is the age they were when they were diagnosed, or when they were contracted the illness. The younger they were when they became ill, the harder it is for them to understand that the symptoms they're living with are symptoms of the disease itself, rather than some aspect of who they are. It is not important in my work to distinguish between what is infection in the brain or an inflammatory process. I leave that to the doctors. The fact is that infection or inflammation, the symptoms are caused by the medical illness, and the medical illness needs ongoing antimicrobial treatment until the symptoms resolve. My work is about helping the patients move off of the belief that they are crazy or there is something fundamentally and permanently wrong with them. The inability to do schoolwork, the short-term memory problems, the temper tantrums, rages, or impulsive outbursts. They have a disease process in their brain, and the doctors are working on developing a better understanding of that disease process and reversing the progression with the goal of their becoming symptom-free. Once the patient understands that, the symptoms become manifestations of the illness, and they no longer define themselves by the disease, even though they're still living with the symptoms. Another issue that needs to be addressed is the prognosis. Suffering from months or years of misdiagnosis, the patients have often come to the conclusion that the manifestations of their disease are permanent. The children may accept that the headaches or abdominal pains are symptoms of Lyme disease, but they often see their mood swings, cognitive and executive functioning problems as part of their personality and not fixable. It is hard for children, particularly young children, to understand that these problems may not have existed had they not contracted Lyme disease and may well be fixable. Even if they are young adults in their 20s or 30s, some people have been told prior to their Lyme diagnosis that they suffer from depression, anxiety, or even that they're simply having memory loss issues due to the aging process. Almost 20 years ago, I met a 28-year-old Lyme patient who was doing very well with her treatment. Prior to being diagnosed with Lyme, she had been told that she had early onset Alzheimer's disease at 28. She was very grateful that someone pointed her in the direction of a Lyme literate doctor, and she was now well on the road to recovery. Lyme disease is a complex medical illness with a profound impact on the brain for many patients, adults and children alike. When I work with a patient or family, we work on seeking solutions to their everyday problems, helping them to plan for current and future needs. Education planning is often part of this process where children are concerned. It is important that patients do not let Lyme disease own them. I work on empowering patients to stand up to those around them who doubt that they are really ill. We look at boundaries, what is and is not okay for family members and friends to say. The majority of Lyme patients that I have seen have at least one important person in their life who second guesses them on treatment details in a way they never would had they had another illness, cancer, for example. What the patients need is support for the difficult decisions that these patients and parents are making, seeking treatment a distance away, often not covered by their insurance, seeking part of the solution in the arena of complementary and alternative medicine, engaging in battles with schools over what the child can and cannot do. For the vast majority of my clients, their brain is affected. Many have unremitting headaches, sleep problems, problems with attention, cognition, memory, and executive functioning. But as they learn about Lyme and come to terms with their abilities and limitations, I also see in many of my clients, children and adults alike, a sense of perspective, knowing what is important in their lives and in the lives of their families. They appreciate the good days and do what they can when they can. And although some of the children complain about the endless medical regimens, the blood draws, the medications, the procedures, they are, for the most part, very compliant and cooperative. Their desire to get well is clear and pronounced, and yet they are faced with an epidemic of denial and ignorance around them, even in some cases hostility. And in many cases, this hostility is coming from the schools. I see children who are too ill to attend school full time. Many of them can't even go part of the day. They have documentation from their doctors, in many cases backed by neuropsychological evaluations, that attest to their illness, their complex physical, cognitive, and sensory impairments, and their limitations. Yet far too few schools accept and understand that these children are seriously ill. Their illness is documented, as is their need for accommodations, supports, and in some cases, remediation. The schools that deny services to these children are denying them a free and appropriate public education, a right and entitlement in this country. The schools that do engage with the parents in a team effort to support these kids are to be applauded for their understanding, professionalism, and compassion. The children who come from understanding and supportive schools thrive, doing the best they can, to the extent that they can, to learn. Their parents support their education, scheduling homebound instructors and tutors, working with the kids during times when their children are feeling well enough to do their work. The team works well, doctors, school, student, parents, and mental health professionals involved. I attend meetings with some of my clients, and the meetings run smoothly as we discuss the difficult issues, with all of us truly looking at what the child needs and how we will support their recovery and their education. But for this team to work well, everyone on the team must have at least a basic understanding of the complexity of this disease. Education in the schools is an essential part of this, particularly in highly endemic areas like ours. A good step is for the districts to adopt the Excellent Time for Lyme curriculum to educate the children. Another good step is for them to commit to in-service training by Lyme-literate professionals for their staff, particularly the team that is educating a student who is chronically ill with Lyme disease. Medical and mental health professionals in practice in this area should be attending the LDA, ILADS, and other Lyme conferences to learn more about the disease and to truly appreciate its complexity. In my 19 years of working with Lyme disease patients and their families, I have seen various manifestations of the disease, some extremely serious. I have heard countless stories of delayed diagnoses and treatment refused prior to patients receiving an accurate diagnosis and effective treatment. The fear and frustration Lyme patients and families face should not be dismissed. They have suffered in the face of ignorance, and many continue to do so. Accurate diagnosis and effective treatment are only the beginning of the recovery story. In our professions as medical and mental health practitioners, educators, and school administrators, in our role as family members and friends of those who have chronic Lyme disease, we can be part of the solution for these patients and their families. Society, as it is today, has marginalized Lyme patients. All of us, as good citizens, can take on the responsibility of providing services, support, and compassion for these patients, end their isolation, and end the marginalization. Thank you.